Hello, Holistretch fam. Welcome to a Holistretch video. My name is Frances Eve, and in this video, we will be working on your client's upper back. So if they have tight traps or their shoulders are up to their ears, they're tensed out, stressed out, this is going to help release that whole area. If you haven't subscribed to the channel, please do. There are plenty of assisted stretch videos for you to learn from. Let's get started. So how we're going to start is we just want to palpate the upper back, the traps. So I like to take the olecranon. This is the part of the elbow that's closest to the upper arm. You just want to lean back onto the elbow to get to the soft part of the elbow, not the very tip of the elbow that can hurt. So just work on the different angles of the elbow and then gently leaning body weight into this part of the arm. As you gently lean your body weight in, what happens is you can release knotted tissue, fascia that has been accumulated and form dense scar tissue. You can start to break this all down using the elbows. So that's what I really like about using this tool. You can take your hands as well and just palpate the area. I like to use my thumbs, but remember that when you use your thumbs, you always want to make sure that your thumb is in alignment with your elbow and your shoulder so that you don't tweak it out. And always lean your body weight into it as opposed to using the muscle. Very good. So we're going to go ahead and bring our attention to the right shoulder. We're going to open the right shoulder. You can stand across the body on the opposite side if this helps you gain access to this area. Sometimes moving signs can give you better angles, different angles. We're going to have your client go ahead and roll onto their left side now. We're going to go ahead and grab onto their shoulder by swinging the arm underneath their right arm. And then gently grasping around the shoulder, you're going to actually bring your fingers inside of the scapula and help to release the scapula away from the trap. Go ahead and cross your hands together. You're going to have your client shrug their shoulder up on the inhale, and then on their exhale, you're going to pull down. So this is a resistance stretch. As they're pulling up and shrugging up, they're creating some resistance as you pull the shoulder down. So it's not quite a seesaw where you pull up and then relax down. They actually hold some resistance on the way back down as well. This really helps to open up the neck, really helps to separate the trapezius, and really helps to relax the shoulder. You can go as slow or as quickly as you want. I always recommend the slower the better, the deeper you can get into the muscle. But I also like to let my client guide the stretch, so however they feel best is how I like to move with them. And after you've opened up the shoulder a bit, go ahead and palpate a little bit more. See if you can feel any knots dissipated or anything moved. You can also move the fingers up to the neck, all the way up to the occiput. Go ahead and have your client open their arm. You're going to bring your hand behind their elbow and they're going to press their elbow back towards you. This is a resistance stretch to really open up that scapula. So as they're pushing back, you're going to bring their arm all the way down. And don't stop right where the table stops. Keep pushing the arm all the way down off the table. This helps them get full range of motion, full opening behind that shoulder. Inhale, push back, and exhale, resist, and bring it down. The more they resist, while you're still able to push it down, the deeper the stretch is going to be, the more you'll be able to break apart fascia. And remember to use your whole body weight and not just your biceps. We don't want to blow out our biceps. Very good. So I tend to do around between 4 and 6. Really kind of depends on what their body needs. But if you're doing this with lots of resistance, even just 4 can make a really big difference. Go ahead and loop your left arm underneath their right elbow and gently pull the arm open. This releases the lats and helps them stretch their whole side body. Very nice. We're moving on to the other side. Go ahead and have your client lay on his right side or her right side. We're going to pull the left arm underneath their shoulder. And then you can palpate with your fingers underneath the scapula here and into the neck. And crossing the hands, you're going to have them shrug up on the inhale and then slowly release that stretch as you pull down. So resisting and slowly releasing on the exhale. Yeah. You'll notice if you gauge to see where their shoulders are when they first walk in, and then you gauge to see where their shoulders are after the stretch, pretty much they always drop about 1 inch or 2 inches down. It's pretty awesome. It's really amazing to release this from your neck. Inhale, squeeze up, and exhale down. Go ahead and palpate and see what kind of difference that you've made. Again, just a few of these can really make a huge difference. And bring your fingers all the way up the neck and into the occiput. And you should start to feel the tissue soften up. And if you feel like they're still dense behind the scapula, like I did with him today, we're going to move on to that second stretch. You're going to have them bring their elbow pressing back into your hand. And then keep pressing back. Have them give you just a little bit less resistance as you push their arm back down off the table, using your body weight to push down. Exhale. Lifting up, pushing back. These stretches are so powerful as well because a lot of people who work out and do body weight exercises will go one way. So if you're doing a chest press, you'll go one way, but very less often they go the other way. And their body needs that. Their fascia needs that. So being able to push them in the opposite way that they work out, oh my goodness, literally a game changer. Exhale, pushing down. And then palpate around and see if you notice a difference. It was much, much softer after we had done this second stretch. And didn't take long. Go ahead and bring that left arm underneath their left arm and pull back. You're going to open up their lat. So good. All right, our last stretch, we're going to have our client lay on their back and then bring their hands together and then lay them by their navel. You're going to go ahead and ground yourself down into the ground, and then you're going to go ahead and bring your hands to their wrists and pull the arms up. So they want to keep their arms a little bit extended, and then exhale as you pull back. Remember that there's still resistance here, but only have them give you enough resistance so that you can manage it effectively and not get burnt out. Have them squeeze their core muscles in so their ribs stay down and they're not overextending. This should really be isolating for the lats, and they might also feel it in the pecs and in the triceps as well. Inhale down, and then exhale, have them squeeze their core down and isolate those arms. To finalize this routine, go ahead and have your client grasp onto your wrists. And then you can go ahead and just lean your body weight back, and this helps to nicely open up their spine and their neck and relieve them of stress for the rest of the day. I hope you guys enjoyed this video. If you have any comments, please feel free to comment below. If there's anything you'd like to see, let me know, and I'll see you in the next video. Take care. Feel free.